We're back talking about low back pain. Today we're going to talk about a few myths that we typically see. We don't try to really delve into this a whole lot when a new patient comes in, just because there's a lot of stuff that kind of goes into it. But just kind of for basic purposes, there's a few myths that kind of around low back pain that we really know. And there's been a lot of good research out there that's told us this stuff. Some of the myths of low back pain. I have a weak core. I'm going to start with this one because this has been huge for years. Not necessarily, and most of the time, honestly, not true. A lot of people we see with low back pain actually have a very strong core. They have very strong ab muscles. What we see with them is they're just very, very stiff. And a lot of times as we start to get movement back into some of those stiff, achy joints, it's enough to keep things moving well and getting that pain to go away. And quite honestly, there are three big things that cause pain in the body. One is inflammation from a fresh injury, like if you smash your hand with something heavy, hurts really bad, hurts for a few days, it's achy, it's swollen, it's sore, it's hot. That's inflammation. That's the body sending tons of healing properties to it to try to heal it up. Second thing that makes experience pain in our body is a very fast, rapid change in temperature. Think about putting your hand in a bucket of ice or putting your hand on a hot stove. That is a very quick change in temperature. That is a signal that your body is getting going, ow, this could be very painful. I need to pull my arm back very fast. So number two. Number three, so the first one's inflammation. It's a chemical kind of pain. The second one is temperature. It's a physical kind of pain. The third one is the joints not moving well. That's a mechanical kind of pain. And we know when we start to get joints moving, when we're talking about stiff joints from a weak core, we get those stiff joints moving, a lot of pain clears up, their range of motion improves, their baselines improve substantially, and we are able to go on and treat, and they can get on with their lives and with the activities that they're doing. So that's myth number one. I have a weak core. Myth number two, I have low back pain. I'm always going to have low back pain. Not true. Unfortunately, we do have a little bit more sedentary life, and some of that sedentary life can be a little bit more predisposed to some of the issues for low back pain. For a lot of people, they have issues with bending and flexing of the low back. And quite honestly, joints, like we talked about, joints can get stuck and cause some mechanical pain. They don't like staying like this for long periods of time. There's a saying out there that your next best position, that the best sitting position is your next best position. So if you spend a few minutes like this, spend a few minutes like this. You spend a few minutes like this, spend a few minutes this way, and vice versa. Basically, they were saying that always stay moving, always keep your posture kind of moving, especially if you have to sit all day. If you have the option to stand, if you have the option to take some breaks, if you have the option for stand-up desk, fantastic. Those are great tools into helping alleviate your symptoms, alleviate your pain, and quite honestly, just kind of giving you a little break and kind of some refresher during the day. Back pain also, we know if it's being treated well, hopefully it's being treated well, can be reoccurrent. It does, and that means it can come back, 6 months, a year, something like that down the road. And what we also know a lot of times is the rehab side stuff that help take the pain away, that some of the exercises, the PT stuff that has happened in the past that has helped, you can do again. It should have the same effect. It should help the pain and symptoms go away, and you should be able to pain-free for a long period of time. Unfortunately, we know that low back pain comes back. It's been proven for years. It's like you have one injury, you've already had an injury, there's a higher chance you're probably going to have that type of injury again. And we just, we want to be proactive. We want to, basically face reality and know it's going to come back again. And that's what we try to tell our patients towards the end of treatment. It's like, hey, this has been kind of your progress. This is what you've done. This is how you keep this from coming back, or how you manage flare-ups in the future. So that's myth number two. I'm going to have pain forever. Myth number three. I remembered it. A lot with new episodes of low back pain or a fresh low back injury of some type, there is a thought that something is actually damaged, that something is something torn, something's pulled, something kind of along those lines. Most of the time, we know that's not the case. We also know, kind of sliding in with myth number four, that imaging is going to show my problem. And honestly, most of the time it's not. Imaging is going to show us is something broken, is something growing in there that shouldn't be, is something actually being eaten away that should be there, or is there something else going on that's going to pop up on imaging that we weren't expecting. And quite honestly, those are very, you have a long chance from that stuff happening. So we know that a lot of times when we get things moving, we allow the body to calm down, we allow the body to feel safe, we allow the body to feel happy, we allow the body to feel like it can recover, and we give the body its proper nutrients. We can sleep, we give it some water, we give it some food, and that kind of stuff. It's kind of like a plant. It just, it grows and it just blossoms. But in our case, the body heals, it gets over the issues that it had, and we can get back to our normal day-to-day. For some people, it is that easy. For other people, we know that they've had this pain for quite a while. It takes a little bit of intervention, a little bit of help, and that's where we step in and kind of like discuss like we did in the past. We're going to see, is there a way we can get you moving that you can start doing at home to help you out? Is there some interventions we can start doing at home to kind of start breaking up the pain cycle you've got, and that kind of stuff as well. So those are the couple myths of low back pain. If you have any other questions or have another myth you would like to discuss, feel free to drop that in the comments or send us a message about it, and we'll be back with you soon.